Well, good morning, everyone, and welcome to the Manufacturing Business Association's Medicare Program webinar. I want to thank all of you for joining the webinar this morning, and I want to thank the Manufacturers and Business Association. My compliments to their president, John Gray, and their vice president, Lori Joint. I also want to thank Casey Nayland for arranging for this, but my compliments to them for recognizing the need for employers to assist their employees who are transitioning to Medicare or are already over 65 and on Medicare. This program has proven to be a big help to a lot of employers who are members of the MBA with respect to their aging employees. So anyway, we will have time for question and answer when the session is over. Lori Joint will be on the webinar, and she will get all the questions and she'll ask me the questions. So we'll have ample time. So please, there's no such thing as a bad question here. And today we're going to talk a little bit about the MBA program in partnership with MediPlanConnect. And then we're going to talk about Medicare Basics. So we're going to go through some of that, some of what we would educate your employees on when you do sign up for the program. I also want to acknowledge that Ed Altoff and Mike Osilka, who are also partnered with us in Northwestern and Western Pennsylvania, will be on the webinar. Ed is our leader of the program, and Mike is also one of our leaders. Mike is centered in kind of the greater Pittsburgh area. Ed is centered in the greater Northwest PA Erie area. So I want to also acknowledge them, and they are our leaders in this program in the region. We operate throughout Pennsylvania, West Virginia, Ohio, and Maryland, so we can handle employers anywhere, frankly, in the state of Pennsylvania, but most of the employers come from either Northwest or Western PA. So with that, I'd like to start. Again, my name is Mike Fiaschetti. I'm the president of MediPlanConnect. We are the company that is partnered with the MBA for this program. And just one slide about us, and then we'll move into the program. But I always start with with the way that we operate. We bring a base of knowledge. Every one of our agents and our leadership, including Ed and Michael, have many, many years of experience and knowledge of the Medicare rules and regulations. But most of all, we get knowledge of a client's needs. That's the most important thing. Every person is an individual in Medicare. There's no two-party or family coverages. So we have to know what their health issues are, what their medications are, their doctors, etc. We treat everybody with equal respect. We don't care what their social, health, or economic status is. They've paid into this all their life. They deserve to get the best product at the best price. We treat everybody with equal respect. We absolutely operate with integrity. We will accept nothing less. And I know the MBA that was very important to them in forging this partnership. So if we go into an employer and we do education and their employees that maybe it's not the right situation for them to come off the group plan, we will not encourage them to come off that plan. And through knowledge, respect, and integrity, we get results. We are also here throughout. So if an employee works with us and they get their coverage through us, we will be there for them if they have to appeal something, if they have a claim issue. We are there throughout the year. So that's just a little bit about MediPlanConnect. So today we're going to talk a little bit about the MBA program with us, and then we're going to go into some Medicare Basics and go through that. Again, our ground rules are there's no such thing as a bad question. This stuff is confusing, and that's why we help so many HR leaders and so many employees in MBA member companies. I want to emphasize this program is a true value-added program. There is no cost to the employer or employee for any employer who is a member of the MBA. So let's get started. Let's talk a little bit about the program. So this program is a partnership between the MBA and MediPlanConnect. It's offered at no cost to MBA member companies. It is education based. So what we come in, the first thing we do is meet with the leadership of the company, particularly the HR leadership, and we describe the program, and I'm going to go through that in a moment. And then the second thing we do is arrange for education sessions. We can do them in group settings at the employer's location. We can do them virtually like this. We can do hybrid, and we will meet one-on-one with individual employees who are turning 65 or over 65 and may want to come off of the group plan. So again, it is education-based. Again, just a little bit more about us. We are an advisory service company. All of our agents are certified, meaning they can offer all forms of Medicare. And frankly, there are two types. There are supplement plans and advantage plans. And if an agent is not certified, they cannot offer an advantage plan, which means they can't do best by the employee or the client. So I just wanted to point that out. We represent all the major carriers. So we have programs for anybody's health or anybody's situation, anybody's economic situation. So here are the steps of the program. If you decide you want to work with us on this program, you can contact the MBA or Ed Altoff or Mike Osilka, and I have their numbers at the end of this program. We will meet with you to start, and we will go through the program, and then we will talk about scheduling education sessions. We have a number of flyers that we use to announce the education to the targeted employees. Typically, we target employees and their spouses who are 62 or over. And then we do the education sessions. And again, we will do these live at your location. We'll do multiple ones if you have shifts. If you're a manufacturing company and you operate multiple shifts, we'll do that. And then once we do those sessions, we hand out a lot of material to everybody. We will also give packets of our material to the HR leadership to hand out to people who are turning 65 and or retiring. Once we do that, people reach out to us and we schedule one-on-one meetings, and we'll meet them at their home. We'll meet them virtually. We'll meet them at a neutral location. If they decide to go on Medicare, we provide that service A through Z. We will get them signed up for Medicare Part A and B. We will find the right plan for them, get them enrolled in that plan, and then we will report back to you, the employer, on who enrolled, because you'll need that information when you do your group health renewal and those folks come off your group plan. That'll be very important information for you to know who's come off your plan and how that impacts your group health insurance renewal. Okay, so those are the kind of the 5 steps of the program. Again, this is a turnkey program, and what we mean by that is there's really very little work that the HR person has to do. And I think, again, my compliments to the MBA for recognizing the burden that this places on human resources in many companies. We will assist you if you have questions about someone who's turning 65 or over 65 regarding their Medicare coverage. You can call us. We will help you through those questions. Again, we will do the education sessions. All you have to do is arrange for a location or a time and place for those. So we will do it A to Z. And again, all of our people are well trained. They're all certified. We provide superior post-sale service, and we have a program and a price point for everyone. Again, these services are no cost to you or to your employee. I want to emphasize that. Okay. So with that, and again, once we get through this, I'll take any questions on that. Now I'm going to go into a little bit of Medicare Basics to do an overview. Now, some of this will be in our education presentation. Our education presentation takes about 40 to 45 minutes. We allow 15 to 20 minutes for Q&A when we come into a company. So you'll get a flavor for the types of things we're going to talk about. This is not the entire presentation that we would give to your employees, but this is a good overview for you, and it'll give you a sense of what we'll talk to your employees about. Okay, so first of all, CMS stands for the Centers for Medicare and Medicaid Services. I think most of you know that, but we've already had people at seminars ask us what CMS stands for. That's the branch of the federal government that regulates the Medicare program. So here are the 4 parts of Medicare. Part A and B are what we refer to as original Medicare. Part A covers hospital services, inpatient hospital stays, skilled nursing up to 100 days, hospice, and part of the home health care benefit. And again, that's home health care, not home care like in long-term care. This does not cover long-term care. Part A, there's no cost for Part A if you've worked 10 years or 40 quarters and paid FICA tax. Part B covers doctor services, outpatient hospital services, lab, x-ray, those types of things. The other part of the home health care benefit, durable medical equipment like wheelchairs, oxygen, and some preventive services like mammograms, colonoscopies, flu shots, annual wellness visits, those types of things. There is a premium for Part B, and the base premium is $148.50 a month. If you're not on Social Security, the Social Security Administration will bill you quarterly. If you are on Social Security, they automatically take it out of your Social Security check. It could be higher if you make more money. That's called the income-related monthly adjustment amount. So for an individual, if you make more than $88,000 a year, or if you're married filing jointly, if you make more than $176,000 a year, you will pay more than $148 a month. And there are 6 categories that go all the way up to $582 a month. Okay. Part D is prescription drug. You can only get Part D through a private plan. And then Part C is a Medicare Advantage plan, which includes A, B, and D benefits, as well as benefits that Medicare does not cover. So I'm going to go into that in more detail. Okay, so let me just talk about some key terms here. I'm not sure. Okay, there we go. So when you have a health plan, you have what's called cost share. That is money that you pay out of your pocket in addition to your premiums for your healthcare services. First type of cost share is a deductible. That's an amount you pay up front before any of your health insurance kicks in. So if you have a $500 front-end deductible, you pay the first $500 before you get any coverage. A copayment is a fixed dollar fee paid against every service. So if you have a $10 primary care copayment, you would pay $10 each time you go see your primary care physician. That's per service. Coinsurance similarly is a per service payment, but it's a percentage instead of fixed dollar. So if you had 20% primary care coinsurance, you would pay 20% each time you go to your primary care doctor. Now, I don't love coinsurance as much because people always say 20% of what, right? You don't know exactly what you're paying. So we like the fixed dollar copays a little better. Okay. So this is the benefit grid if you just had original Medicare Part A and B. And as you can see, there's a lot of cost share, a lot of money you would pay out of your pocket. On the hospital side, you'd pay a deductible of $1,484. But what's worse is if you're in the hospital for more than 90 days in your lifetime, so that's any time over the age of 65, then you would pay $742 a day for every day after that. Part B is significant. A small deductible, but you pay 20% of all services after that deductible with no maximum out of pocket. So if you had 3 surgeries and they were each $20,000, you'd pay $4,000 for each surgery. That could be a significant hit economically. It could be a significant hit to your retirement savings. So that's why you want to get either a supplement or a Medicare Advantage plan. Now, here are the rules. You are eligible for Medicare when you turn 65, irrespective of whether you're on Social Security. You may be eligible before you're 65 if you're considered disabled by the Social Security Administration, or if you have end-stage renal disease. That's what ESRD stands for. That's kidney failure with dialysis. When you turn 65, you can enroll 3 months before the month of your birthday, the month of your birthday, and 3 months afterward. That is a 7-month period. If you are retired and you're not on group health coverage, You must enroll in that 7-month period, or you will be subject to a penalty for your Part B premium. So if, however, you are already on Social Security, you will be automatically enrolled in Medicare. And if you're automatically enrolled and you're still working and you have group coverage and you don't want Part B, you have to tell the Social Security Administration you don't want it. They send a form out and you just sign that and send it back in. Again, there's a late enrollment penalty if you don't sign up when you're first eligible. However, you can defer both Parts A and B if you have creditable employer coverage. So we always get a lot of questions at this point. So what we did was we embedded them right in the presentation, and we do it. We have a little fun with it. We call it a pop quiz. It's funny how people always freeze up when you say we're going to have a quiz. You know, nobody likes a quiz, right? But we're going to give you all the answers to this quiz. So the first question we always get is, well, do I have to enroll Medicare when I turn 65 if I'm already working and I have employer coverage? And the answer is no, you don't. You do not have to enroll in Medicare when you're 65, and you will not be subject to a penalty. However, if your group has less than 20 employees, Medicare is primary and you must enroll. If your group has 20 or more employees, then the person does not have to enroll. Now, that doesn't mean they can't enroll. That just says they don't have to, and they will not incur an enrollment penalty. Okay. The second question we always get is, can I enroll in Medicare Part A and defer B if I have coverage? And the answer is yes, because Part A, remember, there's no premium for Part A. Now, your employer-based coverage, if you're in a group with 20 or more employees, will still be primary, the primary payer. The Part A will be secondary. Now, here's one important point. If you have a qualified high deductible with a health savings account, an HSA, only a health savings, this is not FSA, it's just HSA, you must stop contributing to an HSA if you enroll in Part A. So a lot of people decide not to enroll in A or B if they're still contributing to an HSA. Once you enroll in Part A, you must stop contributing. In fact, the regulations say you should stop contributing 6 months before you enroll. Now, if you remember one of the previous slides, if you're already on Social Security and you get automatically enrolled in Part A, then you do have to stop contributing. You cannot reject your Part A if you're already on Social Security. You can reject your Part B and not pay that premium, but not Part A. Okay. And again, when we're done here, please, this is confusing, so please don't hesitate to ask questions. Lori will ask those questions out loud to me and we'll talk through them, okay? And the last question we always get is, if I'm enrolled in an employer group plan when I, after I turn 65, can I leave the plan and go on to Medicare? And the answer is yes. You can leave anytime after you're 65, sign up for Parts A and B, or if you already have A, just B. Part B will generally be $148.50 a month. And you have to have both Parts A and B to get either a Medicare Advantage or a supplement plan. That's an important point. You must have A and B. So one of the most important things we always tell the employees when we do these education sessions is, please don't wait till the day you retire. Back up 3 months from either when you retire or when you want to come off the group plan, and call us, because we will help you apply for your Part B or A and B. It takes 6 to 8 weeks to get your Part B from the Social Security Administration. Then we need time to sit with you, find a plan. So the way we always time it out, let's say someone's retiring on May 31st. We would ask them to start the process on March the 1st. We will assist them to get their Part A and B. They'll probably get their card sometime in late April. We'll sit down with them. We'll go through their doctors, their meds, any health issues they have, and then we'll find them the right plan. We'll enroll them in that plan for June 1. They'll leave their group plan May 31st, and they won't miss a day of coverage. Here's another.
Whoops, Mike, could I ask one question real quick, just because it relates to what you were just talking about? And a question did come in, so if I could just have you address it now. A person did ask, can an employer pay for an employee's Part B supplement and drug plan with a tax advantage?
Employers are not allowed to pay for either the Part B and or the supplement or advantage coverage in a group with 20 or more employees. They are not allowed to do that. They're not allowed to provide any incentives whatsoever for an individual going to Medicare. That's why the education program is so important. So the answer to that is no. Under 20 employees, they have a little more flexibility. But it has to be part, even under 20 employees, it has to be part of the group health plan, and it has to be equal for everybody. But over 20 employees, no, they're not allowed to, Lori. Okay. So the last really important point here is the federal regulations state that an individual has up to 8 months after they leave employer group coverage to sign up for Part B without penalty. However, they also state that you only have 2 months after you leave group coverage to sign up for an advantage plan or 6 months for a supplement. So again, a very important point for your employees that are either retiring or thinking of coming off your group plan, please back up 3 months from when you're going to do that, because you won't have enough time to get on a plan, and then you'll have to wait till the open enrollment periods to do it. All right. So let's keep moving here. This is an exact replica of the Medicare card. And again, the base premium is $148.50 a month. Unless you are a higher wage earner, then you will pay more. This is the chart. And as you can see, the income limits are $88,000 for an individual tax filer, $176,000 for a married couple filing jointly. And this is based on modified adjusted gross income. And as you can see there, it goes all the way up to $582 for your higher income people. All right. The Medicare enrollment process, by the way, the process to enroll in original Medicare Part A and B is fairly easy. It can be done online. And frankly, we tell people, just contact us. We will do it for you. We can help you through that process. You can do it yourself online or call the Social Security Administration. The local offices are by and large closed because most of the people are working from home. So I wouldn't recommend going into the office. Okay, now we're going to shift gears and talk about the types of plans you can get when you go on to Medicare. And there are 2 types of plans, all right? So let me show you a picture of this, because I think a picture is worth 1,000 words. You can either have original Medicare Part A and B, and then put a Medicare supplement on top of that. Now, if you have original A and B with a supplement, supplements do not cover drugs or dental or vision. So you typically have to buy those. By the way, you also get a penalty if you don't have a drug plan when you're first eligible. So you don't want to incur that penalty. That'll stay with you the rest of your life and can eat into your retirement savings. So you have to get a drug plan. The other way to get your Medicare is through a Medicare Advantage plan. That will include your A and B and prescription drug Part D services. Now, they also have gaps. So sometimes people buy what we call a gap filler or hospital indemnity plan. So let's go into this. Let's start with Medicare Advantage plans. Medicare Advantage plans are offered by private companies like Aetna, United, UPMC, Highmark, Humana, so forth. I'm sure you've all seen all the commercials for these. They are always either HMOs or PPOs. There's no other type of plan in Pennsylvania, by the way. So in the Erie market, in the Pittsburgh market, they're all HMOs or PPOs. And by the way, as you know, HMOs, with the exception of emergency services or dialysis, there is no out of network. So if you go out of network voluntarily, you get no benefit in an HMO. In a PPO, you can go out of network to any provider that accepts Medicare. However, you will get you will have more cost share. It'll be at a lower benefit. So that's the difference there. Medicare Advantage plans must cover those original A and B benefits that Medicare covers. They cover them subject to copays and coinsurance, but unlike original Medicare, Medicare Advantage plans all have a maximum out-of-pocket. That's what MOOP stands for. So in the worst case, you would never pay. This year's federal limit is $7,550. So you would never pay more than that in a calendar year out of your pocket. Remember when I showed you the original Medicare slide, there's no MOOP, no maximum out of pocket. So these plans at least give you that catastrophic protection. Now, the beauty of these plans is they usually include benefits that Medicare doesn't cover, like dental, vision, hearing, fitness. Most of them have silver sneakers, so you can go to a gym for free. And stuff like over the counter, they have catalogs and you can order vitamins, aspirin, toothpaste, that kind of stuff. And they'll give you an allowance of $25 a month or something like that. So they include a lot of stuff. These plans, this is an important point. These plans are guaranteed issue. There's no underwriting. So God forbid if you had cancer or heart disease or anything like that, they have to take you. No pre-existing conditions, okay? And that's when you're first eligible, or 10 years from now, they must take you. You can change these plans 2 times each year during the annual election period, which runs from October 15th to December 7th, or during the open enrollment period, which runs from January 1st to March 31st. So you're not stuck in one plan. You can change from a Medicare Advantage to another Medicare Advantage plan 2 times during the year. Okay, now let's turn to supplement plans. Now, supplement plans operate differently. And let me just explain this real quick. If you have a Medicare Advantage plan, you will get an ID card from that plan, and it'll operate pretty much the way your plans operate today. So you'll use that plan when you go to the hospital, when you go to the doctors. If you have lab tests, you'll take it to the pharmacy. You'll use that one card. Those providers will bill your plan. They'll pay all your claims, and that's how it operates. In a supplement plan, if you go to the doctor or hospital, they will bill the federal government first. And whatever the federal government doesn't pay will cut over to your supplement plan. So that's the difference. So you'll actually have 2 cards, your Medicare card and your supplement card. These are also offered by private companies, and they pay some or most of the portion that Medicare does not pay. Now, one of the beauties of these plans is there's no network, no HMO, no PPO. You can go to any doctor or hospital that accepts Medicare, which is frankly 98% of all doctors and hospitals in the country. So, if you say I want to be able to go anywhere in the country, without any restrictions, Sloan Kettering or Cleveland Clinic or, Johns Hopkins, then, you'll be able to go to those places. These plans do not include prescription drug, so you will have to buy a standalone drug plan if you get a supplement. Remember, if you don't get a drug plan, you will incur a Part D penalty. They'll add that to your payments every month, and you don't want to do that. These plans are only guaranteed issue when you're first eligible, which is either when you turn 65 or when you first come off of employer group coverage. So you could be 67, 68 and just retiring, and you would be eligible. Once you go past 6 months, that's either after you turn 65 or after you first come off your group plan, then you will be subject to medical underwriting and you can be denied. And medical underwriting is basically a questionnaire where they ask you about different illnesses and things. So again, God forbid if you had cancer, heart disease, certain other illnesses like ALS, they would not take you into these plans after your first eligibility period. So if you think you want to supplement, the time to get them is when you're first eligible. These typically have higher premiums. So Medicare Advantage plans, most plans we sell are either 0 premium or $20 a month. Very low cost for a Medicare Advantage plan. These plans are typically about $150 to $180 a month, depending on which plan you buy and depending on your drug plan. So you're going to spend more, but you're going to have richer benefits, less out of pocket, and so forth. I would tell you, we have many, many clients, by the way. I would tell you that about 70% of our clients are in Medicare Advantage plans. About 30% are in these supplements. And that's because the Medicare Advantage plans are lower cost. And, typically the premium savings, adds up over several years that it will pay most of the copays on the Advantage plan. They also add those extras like dental and vision, which people like. So about 30% in supplement, about 70% in Advantage. Okay, now we're going to talk about prescription drug plans. And prescription drugs operate a little differently in Medicare than what you're used to in under 65. And these rules apply no matter which type of plan you get, whether it's a standalone with a supplement or whether it's a drug plan embedded in a Medicare Advantage plan. They all operate the same. They're subject to these are the federal regulations. So first thing, some key terms. The formulary is the list of drugs that the prescription drug plan covers. So the first thing we always do when people work with us is we have a system where we can look up your drugs and see who covers them. We won't put you on a plan if your drugs aren't covered. The drug tiers determine what your copay is going to be. The lower the tier, the lower the copay. And then the network is the network of pharmacies that are either preferred or standard. Every plan in Medicare has preferred and standard pharmacies. You get a lower copay if you go to a preferred than if you go to a standard. So, we always try to find, if your preferred pharmacy is CVS, we'll try to find plans where CVS is preferred. If it's Giant Eagle, we'll try to find plans where Giant Eagle is preferred, etc. So that's how we do it. I'll talk about these two in the next slide. This is the famous donut hole in Medicare. Every plan has it. In 2021, the prescription drug plan must pay the first $4,130 of drug claims in a calendar year. If you exceed that, and that's the total cost, that's both what the plan pays and your copayment. If you exceed that amount, you go into the coverage gap or donut hole. At that point, you have to pay 25% for your medications. Once you hit $6,550 of true out-of-pocket, then you go into catastrophic phase, and the maximum you will pay is 5%. You might pay less depending on generic or brand name drug. Okay, so that's a little bit complex. The health plans must send you an accounting of this, and they will. They'll send it to you monthly, so you'll know if you're approaching the donut hole if you have very expensive drugs and you're going to get into that. This is what a Medicare prescription drug plan would look like. They all have at least 5 tiers, and the generic drugs are always low cost, usually zero, frankly, for generic drugs if you go to a preferred pharmacy. If you go to a standard pharmacy, you will pay more. It's usually either $10 or $20 more. Could be significant. These costs jump up once you get to brand name drugs. So a lot of my clients take something called Eliquis. It's a blood thinner. That's a brand name, and it's either tier 3 or 4. So when we look up your drugs, we try to find a plan where it's tier 3. We've already saved clients $100, $150 a month alone on their drugs by looking those up. So the first key thing that I told all of you is when you're ready to go on to Medicare, please back up 3 months so you can get your Part A and B and get in a plan and not miss a day of coverage. The second thing I will tell you, if you remember nothing else from this, please look up your meds. Tell your employees to have someone look up their meds or do it themselves. We do this as a service. Again, it's no cost. And we have a system that'll do this because you can really make or break your monthly budget on these prescription drugs. Okay. So my last slide that I'm going to talk through are the key considerations that we review with each of your employees, our clients, before we go into a plan. The first question always is, should I take a supplement or should I take a Medicare Advantage plan? So the first thing we look at are health issues. And again, we don't do an underwriting or anything, and we don't put any of this in our system. It's private information. But for example, if someone is in cancer treatment, a Medicare Advantage plan has 20% coinsurance on chemo and radiation up to that max out of pocket of $75.50. So if they're in cancer treatment, we will usually advise for them to take a Medicare supplement. Remember, you can always switch to an Advantage plan later because there's no underwriting to go into an Advantage plan. So these are things we look at. We also look at things like, are you going to be in Florida for 6 months a year when you retire? Well, you certainly don't want a narrow network HMO. You either want a national PPO or a supplement plan. And then, we look at budget. A lot of folks, when they retire on fixed incomes, I had a lady one time come to me and she said, Mike, I just can't afford anything. I said, let's go with a zero Medicare Advantage plan. And I always get choked up when I tell the story because she sent me the nicest letter and said, for the first time in years, I'm able to get my meds filled, and many of them are zero copay. So there's a budget for everyone in Medicare. And then if we decide a Medicare Advantage plan makes the most sense, we always look up your doctors and your hospitals to make sure they're in network, because we don't want you paying the higher cost share for out-of-network services. We also look at the benefits. The supplement plans are all standard. The Advantage plans are all different. They all have different copays, deductibles, coinsurances. So our goal is find you the richest benefits at the lowest possible premium cost. And then finally, as I said earlier, it is imperative that we look up your medications. We always get a list of your meds to see, A, are they on the formulary, and B, what are the copays? And we will find you a plan that covers your drugs and covers them at the lowest cost. So that is the end of the formal presentation. And again, there is the contact information for Mike and Ed. They are our leadership in Northwestern and Western Pennsylvania, in the greater Erie and Pittsburgh markets, and all counties in between. Again, we operate throughout all of Pennsylvania, so it doesn't matter where your location is, we can accommodate you. So with that, I'll be quiet, and Lori, I'll turn to you for any questions that we may have from the audience.
Yes, thank you, Mike. The only other questions, we've had a few more, but they're related to the same thing. People have been asking if they'll get an email with a copy of the slideshow presentation today, and we will be sending that out, but we'll also have this presentation available on our website if there's anybody that would like someone else to have access to it or be able to see it, because it is very helpful, I believe. But anybody else that has questions, please go ahead and use your question box and send them in, and we can get your questions answered now. Not seeing anything else pop up at this moment, Mike. We can just talk through a couple more things, give it a few more minutes while if people are thinking of stuff they might have. But like you said, you have your contact information there. We would encourage people to reach out at any time. They can ask any questions that they have. That's, like you said, it's a very confusing topic, and a lot of the companies that we work with have just found it very reassuring to have somebody that they can call, talk to, ask questions, but also have them come and talk to their employees. Because sometimes it is a better option. For some employees, it's a better option than remaining on their company plan. It just really depends. So.
Yeah, Lori, that's right. We've gone in and done education sessions, and it's nothing for 7 or 8 or 10 people to call us and say, I can actually get lower cost and slightly better coverage, because let's face it, employers are struggling with the cost of health insurance. It's really expensive. So they've been forced to raise deductibles and raise, payroll contributions. So oftentimes the people 65 and older can get better coverage on Medicare, and that's a win-win. I hate to use that cliche, but they get better coverage, and the employer reduces their costs and has an employee relations win from it.
Very true. Is there anything else you wanted to add, Mike? I don't see any more questions coming in, but if you want to go ahead and just close it out or add anything other comment-wise that you have, if I get any as you're continuing to talk, I will let you know. But if not, we can follow up and we will get this presentation out to anybody that registered to attend the webinar today.
Well, Lori, again, I want to thank you and the MBA for recognizing the value of the program and the needs of your constituents, your member groups. So first of all, thank you. And I want to thank all the folks that attended today. This is confusing and complicating material, and our folks are experts. Mike and Ed can help them, and any of our other team members can help them through these issues and help their retiring employees. So please don't hesitate to call us. We would love to work with any and all of you. So thank you, Lori.
Thank you, Mike, and have a great day, everyone. We'll go ahead and end the webinar now. Thank you so much. We appreciate it.